I think we're live now. Can everybody see us? If you can see us, say hi. Okay. Well, we're going to go ahead and start here. So this is a webinar we're doing for hyperbaric therapy and many different ailments and different problems people have as far as stroke, cancer, things like that. But today we're going to do something a little bit different, just to introduce everybody to what we're doing. And this is Bill, and this is John. So they're kind of the gurus when it comes to hyperbaric therapy. And so, Bill, can you tell us a little bit about what hyperbaric therapy is and what it can do for other people?
You know, it's amazing something as simple as oxygen under pressure can do so much. And I think the first thing you have to do is understand what the basics of hyperbaric therapy is. So when you're in a hyperbaric chamber, the mild chambers that are FDA certified for in-home use, you're laying in there and typically you're breathing 95% oxygen through a mask. But the key is the pressure. The pressure is forcing that into your cells, into your tissues, and into your body fluid. So what that does, number one, it's improving your immune system. Your immune system needs oxygen to operate at its optimal level. As we age, we don't breathe as much as deep as we used to. We're not as active, and our immune system becomes compromised, and we start picking up diseases that's been fighting off our whole life. Secondly, it detoxifies the body. It's forcing oxygen into your cells, and by doing that, it's forcing the impurities out. It reduces inflammation. It improves the blood and oxygen flow throughout your body, your circulation. It increases the production and circulation of your stem cells after 40 sessions over 800%. It repairs and rejuvenates damaged cells. It builds new blood vessels in damaged areas. It repairs nerve damage. It improves your clarity. It improves your focus. It improves your stamina.
So I have a couple questions for you on that. What I'll ask some more questions as we go on here, because we got about half an hour on it. So I wanted to cover a few questions in the beginning. What happens, or what was your experience with hyperbaric therapy, and how did it help you? How did you get into it originally? What started you on it?
Well, I was diagnosed with stage 4 throat cancer. That was 8 years ago. To this day, I spend an hour a day in the hyperbaric chamber. There's a lot of different reasons why people acquire cancer, but the primary cause, the number one cause of cancer, is the lack of oxygen at the cellular level. So I went out to a clinic in Atlanta. I had a tumor about the size of a lemon on the side of my neck. And when I went into this clinic, they said, the tumor is not going to kill you. What's going to kill you is that metastasizing throughout your body. So we're going to put you into a hyperbaric chamber because cancer, being a virus, cannot survive in an oxygen-rich environment. So we're going to put you in the chamber and fill your cells with oxygen so the cancer can't spread, and then you can go back and find ways to take care of your tumor. So I actually bought a chamber and spent an hour a day for 2 years in the chamber, hoping it would dissolve my tumor, because I had read a lot of testimonials where it had, but it didn't. But during that 2-year period, the stage 4 throat cancer never spread. At the time, it was like getting hit over the head with a sledgehammer. I've always said I'm going to be really pissed when I die because I love living so much. And to get diagnosed with stage 4 throat cancer wasn't in my cards. I'd never been sick a day in my life, and all of a sudden, I had stage 4 throat cancer. Today, I look back on that day as a blessing, because we wouldn't be sitting here able to share this knowledge and able to give people back lives they thought they'd lost forever if it wasn't for me finding out about that hyperbaric chamber and what it can do for people.
Wow, that's amazing. I mean, so my next question is how have you been able to help other people with what you're doing, with your story and all that? How have you been able to spread the word and help other people?
Well, I talked to Dr. Cornell to see if he would be interested in adding hyperbaric therapy to his practice. And after doing some research, he agreed that we should do that. And today we have multiple clinics, and we have made a habit of giving people back lives that they thought they'd lost forever. We have MS patients who couldn't feed or bathe themselves that are working 40 hours a week off of all their meds. We have children with cerebral palsy that are running and jumping for the first time in their life. There's not a day that goes by that I don't get phone calls from stroke victims and cancer patients across the United States that want to buy a hyperbaric chamber because they've heard what it can do for them. Lyme disease is almost an epidemic right now. It's amazing how many phone calls we get from people. I have a lady who wrote me a letter about 2 weeks ago. She had bought a chamber from us about 2 months ago. She had Lyme disease. She wrote me a letter and said, I was diagnosed with Lyme disease 11 years ago. I had honestly forgotten what it felt like to feel good until I got the hyperbaric chamber. If we put that in perspective, if that lady had found out about hyperbaric therapy 11 years ago, she would not have lost 11 years of her life when there's something out there that could have helped her. That's our mission. That's the reason that we're having this webinar, is so that we can educate people on what hyperbaric therapy can do for them and their loved ones. Think about the father whose son had a traumatic brain injury in a car accident or motorcycle accident. And he sits on the edge of his bed every morning wishing that there was something out there that could help their son, not knowing that there is. There are so many people in that position, and that's our mission, is to educate people so that they can make the decision as to whether hyperbaric therapy is for them or not for them.
That's unbelievable. I mean, some of those stories that you hear and the things that hyperbaric therapy has done for other people is pretty unreal. So I am gonna shift the focus a little bit here, and I'm gonna bring Dr. Cornell in. This is John Cornell.
Hello.
And he's here. He's the one who partnered up with Bill over here to get hyperbaric therapy going. Can you tell everybody a little bit about yourself and what you do? And
Well, I've practiced in Gig Harbor for 38 years. I started out here after I graduated from college. And I had the same condition that Bill had 2 years after Bill had it, the cancer in the throat. And Bill was telling me about hyperbaric chambers, which I knew nothing about, absolutely nothing. We learned about oxygen and how it functions in the body, but had no idea about hyperbaric chambers other than the use for burn victims and people suffering from the bends. And that was all I knew about hyperbaric chambers. Bill educated me and gave me a few books to read and things to look up on the internet and things that he was mailing to me through the internet. and I started reading up on hyperbaric chambers, and that's how I got involved in it. So Bill and I opened up the clinic here at Gig Harbor, and since then it opened up many more, and seen a lot of children with different conditions. We've had children come in with their parents with autism. We've had stroke victims, heart attack patients. We've had patients that come in that were going to have knee surgeries, and they came in because they found out that stem cells build up in your body after being in the hyperbaric chamber for 40 hours, what the stem cells do, and how quickly they have responded from having injuries.
Wow.
And how quickly they heal.
That's amazing. So I had a question about the stem cells. What is it in particular does it do? How to explain about the stem cell part of it?
Stem cells are one of the healing forces in your body that replace cartilage, bone, soft tissue, such as ligaments, tendons, muscles, tissue cells, such as in the kidney and so forth. So the stem cells in your body is one of the healing forces. I mean, there's many other things that happen, but carrying oxygen in your blood vascular system helps healing. They didn't know much about hyperbaric chambers until people that had the bends from coming up too fast from down below. They had other conditions that were healing, such as arthritis and psoriasis on the skin and different things that would heal very quickly. And they had no idea what it was that was causing this. So then they started doing some research with people with other conditions and hyperbaric chambers.
Wow. So I did a little bit of research before we started the webinar here, and I noticed that when I was looking at the hyperbaric chambers, they actually increased the stem cell regeneration by
Yes.
800%?
Yes,
Is that correct?
that's correct.
Okay. That's unbelievable. So I'm going to shift the focus just a little bit because we were originally talking about this event being mainly on stroke, and I wanted to touch on, let me see if I can back up the camera here a little bit so everybody can get in it. But I mainly wanted to get everyone to know who John is and who Bill is. And so I had a couple of questions for you, Bill. You know, you see stroke patients all the time. What in particular has a hyperbaric chamber done for stroke patients that you've seen or talked to?
Well, to be honest, there's probably more testimonials on the internet on what hyperbaric therapy has done for stroke than on any other health issue. Our very last stroke patient in this clinic right here, when she came in, she's about 40 years old, relatively young to have a stroke, and had a lot of living left to do in a body that wasn't cooperating. She was in a walker, and she could barely use the walker. Our clinic here is on the 3rd floor of a medical facility. This lady just finished her 40th treatment, and she is now walking up 3 flights of stairs completely unassisted, no walker, no cane, nobody helping her. And she's doing it day after day after day.
Wow.
This is after only 40 treatments.
That's unbelievable. So what do you think, you know, a lot of people have questions about, you know, hyperbaric therapy, what it is. You know, I know you touched on it a little bit earlier about how it can help people. And what do you think the main factor was with your patient, Dahlia, that helped her heal so much?
Well, if we go back to the basics of what we went over before, you can take those basics and apply to almost every health issue. almost every health issue out there is inflammatory based. Is that correct, Doctor?
That is correct.
So when you're looking at a stroke, number one, it's increasing the blood and oxygen flow into the brain. Number two, it's reducing inflammation. Number three, it's repairing and rejuvenating damaged cells. Number four, it's building new blood vessels in damaged areas. And number five, after 40 seconds, it has increased the production and circulation of your own stem cells over 800% based on studies that were done at the University of Pennsylvania. And your stem cells are the main healing force in the body. So, we have a stroke patient out of our sister clinic in Atlanta. She was had a massive stroke at 54 years of age. She was in a coma, not expected to live. When she came out, she couldn't walk, she couldn't talk. Today, she's dancing and singing karaoke. And she says in her interview, anybody that tells you that hyperbaric therapy doesn't work is a damn liar. But we see it time after time after time.
Wow, that's unbelievable. I mean, so we were talking a little bit about the science of stroke and about how can we get a better picture of what's needed for the recovery process for stroke, and with hyperbaric therapy or therapy in general. Is that a question I should ask Dr. Cornell, or do you?
Rephrase the question.
No, I wanted to talk a little bit about. I guess let's rephrase the science of stroke. How can we get a better picture of what's needed for the recovery process of stroke? I'm sure there's probably a lot of factors that play into it.
Do you have an answer?
Well, there's lots of different strokes. There's heat stroke. Person can go into a hypothermic stroke. There's hypovolemic stroke. There's strokes from blockages, which would be a hypovolemic type stroke blockage, blood blockage in the brain, some type of clot. It can move up from the lungs or through the heart, and anyway, eventually get up into the brain and cause the stroke. So there's many different causes of strokes, and some of them will heal a lot quicker than others, but it's basically trying to get your body healthy again. Get the oxygen cells into the blood vascular system, and get every cell in your body needs oxygen. That's one of the powerhouses of your body. Not only needs nutrients, but it needs oxygen just to function. Without oxygen, nothing functions properly. Somebody asked me about food and how long your body could survive without that. I was saying, well, you could go, depending on your body weight, you might be able to go a week to 10 days without food before you start suffering. You could probably go a few days without water without suffering. But how long can you go without oxygen?
Well, that's a pretty easy answer there. Just a few seconds.
So that shows you the importance of oxygen over everything else, over food and water, although you need all these factors to be functioning. But the most important one is the one that you can live the least amount of time without, and that would be oxygen.
Wow. So, correct me if I'm wrong, at one point you yourself had a stroke.
I did have a stroke, and it was a blood blockage in the brain stem. And they were checking me for a heart attack. That's what they thought that I had, because I had no symptoms of a stroke. I didn't have any prolapsed tissue in my face. I didn't have any paralysis in the muscles. I didn't have any of the major symptoms that you see of a stroke. So they were checking me for a heart attack until they did some neurological checking and found out that I did have a dysfunction. It was on the left-hand side of my body. After that, then they started treating me for stroke to get rid of the blood blockage. Probably the reason why I didn't have any of the other symptoms is because of the time that I spent in the hyperbaric chamber. So that's why I didn't have the normal symptoms of a stroke.
Okay. So I do, because, we are talking a little bit about stroke today. What are some of the other factors that you would recommend, being that you had gone through your own stroke, to prevent it or recover from it, overall? What changes would you recommend, or things that people would have to do to
massively oxygenate your body? I mean, if you could, there's a lot of different ways you can do it. Cardiovascular, the hyperbaric chamber is probably one of the easiest ways that you could do it. You don't have to have any exercise. In Henry's Law, which anybody can look up in the computer or in a dictionary, and it tells you a little bit about how oxygenation of your body works with the explanation of Henry's Law.
Okay, so I'm going to go back over to Bill here, and I had a couple questions for you, Bill. So it's my understanding that that a hyperbaric chamber goes to 1.3 ATA. Can you explain the pressures and how the technical part of the chamber works?
The mild, there are two kinds of chambers. There's the mild chamber and then there's the hard chamber. And the hard chamber goes to higher pressure. Our instincts tell us that, okay, if oxygen under pressure is good, more oxygen under more pressure must be better. But in reality, that's not necessarily true. In many cases, the body puts a wall of resistance up against the higher pressure, whereas it absorbs the milder pressure. That's why, for example, a traumatic brain injury, the first 2 days after a TBI, higher pressure is better. After that, it really doesn't work. That's why all of your tests have been done at the lower pressures, around 1.5 ATA. The chambers are FDA certified for in-home use at 1.3 ATA, which is equivalent to 4 PSI, or roughly 11 feet underwater. It's mild pressure. Now, for the majority of the cases, mild pressures will do everything that the higher pressures will do. They just won't do it quite as fast. For example, wounds will heal faster at 1.75 or 2 ATA than they will at 1.3. But at 1.3, they're still going to get there. You just have to stay in a little bit longer. So there are two mild chambers that are engineered to go to higher pressure. It's illegal for us to sell them at anything over 1.3 ATA, but they are engineered to go up to 1.75. One of those is Quambus, which is made by Aussie Health, and the other is the Class 7 made by Newtown. Now in Europe, that's what we sell over there is the mild pressure at the 1.5 or 1.75 ATA.
So interesting. Does that so when the chamber goes up to pressure, what does that pressure do exactly? Because that's a question that I've had for a while, and that's, when it's at that pressure, how is that any different than where we're sitting at, say, in our chairs or any things like that?
Well, we get asked all the time. One of the things when you're in the chamber, you're breathing 95% oxygen from an oxygen concentrator. Many people say, well, if I just buy the concentrator and I don't buy the chamber, is it going to do the same thing? The difference is that the pressure is the key. The pressure is forcing the oxygen into your cells and into your tissue. I get asked all the time. So if I buy a chamber and put it in my home, can I sleep in it? I do. And yes. But they ask me, will it help? And my belief today is no. Even though when I had cancer, I slept in the chamber many nights. If we go back to what the chamber does, you're laying in the chamber, you're breathing 95% oxygen, but the pressure is forcing that into your cells. Well, once your cells are full, they're full. The bigger question is, how long is it going to take for those cells to deplete before we have to fill them up again? And everybody's different. Some people might be once a day, some people might be once a week. So something that we operate a chain of hyperbaric clinics, and we treat people all day long for a wide variety of health issues. The challenge with the hyperbaric chamber is that because insurance doesn't cover the majority of the health issues, it doesn't matter how bad somebody's pain is, the pain is throwing their wallet out first more. So for that reason, what we talk to our patients a lot of times about doing is finding a way, coming in and doing 10 treatments to see that the chamber is going to do what they want it to do. And then find a way to put one of these in their home. Because for two reasons. Number one, in the long run, it's more cost effective. But the other side is that frequency is an issue. To see the benefits, you have to do it almost every day. And having one, and for most people don't have the ability to take 2 to 3 hours out of their day, day after day after day. So having it in your home, not only can you get into it when you want, but your whole family can and should use it. But I got one question for you, Brad.
Yeah.
You are a TBI victim.
Yeah, I was.
You want to talk about that for just a little bit?
Yeah, we'll get to me in a second. I had a couple other questions about, number one, about the oxygen. I'm curious about the oxygen because me personally, I did have to use a hyperbaric chamber in a car accident that I was in. But my goal here is to try to understand, better understand for myself, because I didn't know what I was getting into when I did it. That's what they did. And with the oxygen, I did my research before we started this, and I noticed there's a couple different types of oxygen. There's 100% oxygen, and there's the 95%, and there seems to be some controversy about it. Can you explain a little bit more about 100% versus 95%?
I don't really think there's a controversy. It's just that I've never seen any studies anywhere that says 100% oxygen can do something that 95% can't. And using 95% in your home is way safer. 100% oxygen is a gas. It's flammable. You have to worry about oxygen toxicity. With 95% oxygen, you can sleep in the chambers and not have a problem. As long as you're not going over 126 ATA. At 126 ATA, then you have to start worrying about oxygen toxicity.
Interesting. And now, is that something do you know why, or is that a question for Dr. Cornell, or?
I don't know if Dr. Cornell knows why. But
So
About what?
moving. So once we get to, do you know why? Once we get over 1.6 ATA on the hyperbaric chamber, that we have to worry about staying in there too long as far as toxicity in our blood.
Well, you can Many things cause toxicity in the body. You can use too many vitamins, too many drugs. We know that for a fact. There's a lot of drug overdoses from prescribed and recreational drugs. So you can toxify the body with too much oxygen if you get too much oxygen. But you have to have 100% oxygen to really toxify the body. You couldn't do it any other way. With 95% oxygen, you can breathe that all day and all night long. Like Bill says, he slept in the chamber before. So there's no problem with that. Your body will dispel what it doesn't need. It uses what it needs and gets rid of the excess oxygen that it doesn't need. 100% oxygen in the body can't get rid of that 100% oxygen as easily as it can at 95. Plus, you don't have to worry about the explosiveness of it. There's been a lot of, we lost 7 astronauts down in NASA when they were doing testing, and they were in with 100% oxygen when they're.
Interesting. So that can, so having too high oxygen can cause problems
Yes.
overall. Okay, so now Bill asked me a question. He said, I was he said he knows that I was a TBI patient because when I first met these guys, I was coming in for treatment myself. And I was hit by, like I said earlier, a drunk driver in 2008. I ended up in a body cast. I had to learn how to walk and talk all over again. And I attribute all of my healing to where I am now to the hyperbaric chamber. I never really knew what it did or how it worked until I met these guys and they started training me. And that's why we decided to do the webinar here. It's pretty unbelievable. I mean, I'm walking, talking proof of what a hyperbaric chamber can do for you. And it's pretty unbelievable, what it can do for everyone. So what would you say, with everything we've talked about tonight, what would you, we'll start with you, Bill, here, then we'll talk to Cornell. What would you say is the #1 best therapy option for stroke or for traumatic brain injury or, things like that? I mean, I know there's so many different avenues and so many different claims and things out there. It's hard to sit down and really find, what works and what doesn't work.
Everybody's different, but the bottom line is when you've had a stroke, when you've had cancer, when you've had traumatic brain injury, anytime you get dealt a serious blow from a health issue, it's going to change your life. And if you care about living, you're going to start researching everything you can as to what's right for you. I'm extremely biased that every family should have a hyperbaric chamber in their home because I've seen what it did for me. I see miracles in our clinics every week. But the people need to change their diet. They need to exercise. They need to change their water. They should drink Kangen water. Basically, people are entering a new part in their life, a healthier part in their life for most. I can tell you this. Before I was diagnosed with stage 4 throat cancer, I paid no attention whatsoever to what I put in my mouth. I owned a bunch of burger chains. I love a cheeseburger. Today, I pay attention to everything that I put in my mouth. So it's just adapting a healthier lifestyle. I believe today, here's the thing. We live in a reactive society. We wait until we get sick before we do something about it. In my opinion, the hyperbaric chambers will allow you to be proactive about your health instead of reactive. I think you should add Kangen water to it, but that's not what this is about. So be proactive instead of reactive, not just for you, but for your loved ones. When you buy a chamber and put it in your home, everybody in the family should use it.
Okay, so Dr. Cornell, what we just got Bill's input on the number one best therapy option that he recommends, and as we know, he's extremely biased towards everyone having a chamber in their home. And what do you think? What are you thinking as far as you've been in the medical industry for a long time, chiropractic and all that stuff. So what do you think would be the best therapy option for someone trying to recover from a stroke or similar injuries or things like that?
Anything you could do to the body to make the immune system stronger. And hyperbaric chambers obviously have done that. They're doing a lot of studies on it all over the United States. Actually, in the world, they've done a lot of research on stem cells and hyperbarics in places like Russia and France and Spain. So other countries do a lot of research, and they have hyperbaric chambers. Like, for example, Bill and I were talking a few months back. In Japan, they have hyperbaric chambers that they're using on in their Medic One vehicles when they pick somebody up from as a stroke or heart attack or automobile accident or whatever they're picking them up for. To rush them to the hospital, they put them in a hyperbaric chamber because they know they heal twice as fast. They get it started as quickly as they can. When somebody's had a heart attack, a stroke, or anything else, our Medic Ones, when they come out there, one of the first things they do is they put an oxygen mask on you and start getting oxygen into your body. Well, they do that because they know the importance of it.
So interesting. So you're trying to say that we've always kind of been the Western medicine, we've always kind of been slow to adapt to things, and from what I'm gathering is we're a little bit behind the times. Wrong, but that's what I'm taking from it. That we're just we're not catching on and promoting it the way it should be promoted for all the amazing reactions we've seen from people. So we're getting close to the end of our time here. I'm going to go ahead and turn this over to the audience and the people watching. Does anyone have any questions for Bill, me, or Dr. Cornell? Let's see if we got someone respond here. Okay, so looks like we got one question. So this one's for Bill here. What the question is, how it's kind of related, but how can it help with small things such as headaches and things like that? That's actually a really good question. If you does it help blood flow in the body?
It increases the blood and oxygen flow throughout your whole body, but specifically into the brain. People with migraines, a couple of years ago, we had a lady come in, and she had constant migraines. I don't know if you remember her, Dr.
I do.
But she came in, she had a little, probably a 3-year-old boy with her. And she says, I know you're not going to be able to help me. I've tried everything. I've had a migraine for every second of every minute for the last 2 years. And when we put her in the chamber, and when she got out, she says, oh my God, I can think. For the first time in 2 years, I can think. And I'm sitting there thinking, how in the world could you raise your 3-year-old boy with migraines for every second of every minute for the last 2 years? What a nightmare when there was something so simple that could take care of it. And there's no side effect. Now, I do get asked by women all the time, what are the side effects of the hyperbaric chamber? And I tell them, because of the anti-aging benefits, we do have to be careful with women and not leave you in there too long. It would do amazing things for my brain.
Okay, so we got another question here, and this can kind of be to either you or John, and we'll let John answer this one here. So Dean over here is asking, where can we find a hyperbaric facility?
Well, in Gig Harbor is our main hyperbaric facility that we have. It's 4,700. We're in the Franciscan Medical Building on Point Fosdick. But we have one in Olympia. We also have one in Wenatchee. There's one on Lopez Island. We have one up in Moses Lake. So there's many different hyperbaric offices that we have run here in the state of Washington.
Okay, and is there any way that they can get treatment through your facilities outside of the state of Washington? Is there any other areas they can go to, or is it just basically here in the state of Washington?
If they contact our number here at the Gig Harbor Clinic, we can certainly refer them to other clinics that we have around the country. Planning on opening up one in Iowa here shortly.
Okay.
And another question, somebody said something about headaches, and Bill was talking about headaches. We've known about hyperbaric, or we've known about oxygen actually in studies against headaches. World War II, when some of the pilots would go out and have a few too many drinks the night before, one of the first things they would do is get into a cockpit of their airplane and stick on the oxygen mask to clear their head out. So alcohol, drugs and alcohol, they both displace the oxygen molecules that you have in your blood vascular system. So increasing that gets rid of the headache. They've known that for years. But hyperbarics obviously work a lot quicker because you have the pressure with it.
So we've known about this for a long time.
Yes.
A long time, and it's just now coming to fruition where people are starting to finally catch on to it. So Bill, were you going to add something? Or
I was just going to say, we work with a lot of people. We work with people all over the United States, and a common question is, where's the closest clinic to me? And the reality is because insurance doesn't cover hyperbaric therapy, there aren't a lot of clinics around the United States. But what we can do to help these people out, and we do it all the time, is we'll rent them a chamber. And by putting a chamber in their home, now instead of coming in for treatment 3, 4, 5 days a week, they can get in the chamber in their home every single day, and everybody in the family can use it. So that's an option. If a clinic isn't in an area that is close to you, then give us a call and we'll help you out.
Awesome, and then what's the number that they can call over there to get a hold of you guys if they need to find out more information or even to ask you more questions personally?
They can always call me at 253-363-0500. I'm sure they can call you too, Brett.
Yeah, they probably could. So that's pretty much about it. We're just about out of time here. I want to thank everyone for coming to our webinar here. We're going to make this a weekly thing so we can update on a different ailment, a different problem every single week. This week we touched a little bit on stroke. We touched a lot on hyperbaric therapy and what it can do. And that's what the main focus is of our webinars. So we can sit people down and we can say, hey, this is what it can do. This is what it can't do. And I think Bill and John did an awesome job at being able to answer some of the questions I had. Were kind of interesting and tough to answer, but I think they did a great job at answering it. And I hope everyone else was able to take something away from this. And we can't wait till next week.
I'd just like to add one thing. We are going to make this a weekly show because our job is to educate. If you have any friends or any family that has any health issue at all, join the webinar and find out if hyperbaric therapy is something that can help them out.
So, you know, as of now, we're just about out of time. We will be here next week. We'll have more questions. We do have, it looks like I was just handed a number here for a call center number. It's 855-592-6003. And that'll direct you to the H3 clinics over here to talk to either Bill or John. Thank you, everybody, for attending. We can't wait till next week. Stay tuned and check our Facebook. We'll send out more ads, things like that to you guys so you can see what we're going to be touching on next week. Thank you, and we'll talk later. Goodbye, everybody.